Hello, this is Dr. Murat, and today I will try to answer the most frequently asked questions of yours. Obesity is a condition characterized by the excessive amount of storage of fat in your body. It affects not only the appearance but the disease processes as well. Any patient presented with a body mass index over 40 is automatically eligible for the procedure. Additionally, if you have a body mass index over 30, with detailed assessment, you might be eligible as well. Sleeve gastrectomy is being performed with a keyhole method. Uniquely for our clinic, it's being performed via 3 little incisions, which helps the process of recovery and decreases the risk of secondary organ effects. It's being done under the general anesthesia, and generally the operation duration takes 45 minutes to 1 hour. After the operation, the effects start immediately, and with our nutritional support, you will be able to lose weight in your preferred pace, as long as you keep nourished and healthy with our diet guidance. Your hospital stay is going to be 4 to 5 days, and after that duration, you can be discharged from the hospital safely. We are going to conduct many tests like electrocardiogram, ultrasonography, blood tests, and any consultations with the other various fields of medicine to make sure that your operation will be done in safe environment. We are able to arrange your stomach volume according to your weight loss goals. So as long as you keep a balanced diet, as anyone should, this operation does not cause any malnutrition issues. Normally, sleeve gastrectomy might keep its positive effects for long years or even for a lifetime. But if the patient forces its stomach to its limit by overeating or excessive amounts of consuming carbonated drinks or things like that, you might end up with a stretched stomach again after some long term, like 4 or 5 years maybe. But a revision operation is always possible, but this is not a scenario that we want for you to face. So as long as you do the things that we say for you to do, you will have no problem as it is. Loose skin is a condition that stretch skin becomes loose when you have lost a significant amount of weight. But this is not just exclusive for bariatric surgeries. Any conventional way of weight loss might cause the same thing. It depends on your genetics, it depends on your exercise levels, and many other stuff like that. But in the end, some people might get loose skin, and it is again an operable and repairable problem. But the thing is, as long as you keep your exercise and keep your diet, we can make it at least at minimum. Well, we do not recommend our patients to do heavy work, at least for the first month following the operation. But as long as you're discharged from the hospital, you can go back to your daily routine life and you will have no problem with that. But for those who are working in heavy jobs, it might take a few months for them to go back to their ordinary life. After the operation, usually our patients do not need to stay in the intensive care unit, but for some, especially for those who have more risk, have higher risk than normal population, we can advise you to stay in the intensive care unit for a short period of time, maybe 1 day or two, just in case. Well, previous surgeries usually do not hinder this operation, but it might increase the operation time. It can make it from 45 minutes to, it can carry it to 1 hour and 1.5 hours maybe, because previous surgeries usually cause adhesions in the tissues, and it is a little bit harder to operate in such times, but they are usually do not hinder the operation itself, as I said. We will provide routine controls and nutritional support and assistance support for 2 years, or if you need them for more, again, without any charge, we are offering you any support you might need. Well, you can perform basic exercises like walking as soon as you are discharged from the hospital, but we do not advise you to perform heavy exercises like lifting for a few months period, just to prevent herniation or any kind of complications like this. I have tried to answer most of your most frequently asked questions, but in case you have more questions in your mind, you can get help from our professional assistants at any time you need, and stay safe.